My name is Amy Molina, and I work at Joe DiMaggio Children's Hospital. I received a phone call from my older daughter that my son Jason had been hit by a car walking home from school, and that he was being trauma alerted to Joe DiMaggio Children's Hospital.
I saw headlights when I was walking across the street to the other side. Headlights.
I immediately hopped in my car with my dad and I drove to the hospital. When he arrived at the trauma bay, he had road rash on his face, on his head, and a swollen eye that was swollen shut. As the mom, when I was watching my colleagues as they were working on him, I didn't have to do anything. I knew that they were going to take really good care of him. The new hospital that they've built for Joe DiMaggio is going to be fantastic for the community. It's beautiful, it's well thought out. They have everything in there to entertain the kids so that they're not so frightened being in the hospital.
We decided to get together and say, well, what do we want to do for our patients and our families to make the best facility that we can? So the physicians and the staff, as well as some of our families that have had care through the hospital, got together and we essentially built the Children's Hospital from the inside out.
One of the best things about the designing of the hospital is that it wasn't just a bunch of engineers deciding we're going to put this here, this here, this here. It was actually a whole team of nurses and doctors, and the families have also helped with the designing of it.
And we did some site visits to some other children's hospitals throughout the country to take the best ideas from those facilities to bring them back here to South Florida.
They really have a holistic way of treating the family. They want the family participating in all the care of the children.
It's a good hospital. I like it there.
I'd like to invite you to welcome the new hospital to your community and say, hey, glad you're here.